Hello, welcome to our new patient orientation video. I'm Dr. Noah Kaplan, and the purpose of this video is to provide you with the most important information that you're going to need in order to get the most out of your care and maximize your results. So this is going to include the science and strategy of upper cervical care. It's going to include just some care plan, office flow, and care plan schedules so you can get a sense of kind of where we're headed and how things are structured. And then finally, it's going to include some at-home strategies that you can implement on your own, whether it's at work or at home, in order to get the most out of your care.
Hey everyone, Dr. Daniel McClelland here. Let's dive into the subject of what upper cervical is, what the implications are for you, and how this has been affecting your symptoms and your treatment. So upper cervical refers to the top two bones of the neck, which are C1 and C2 here. And the reason why these two are so important is because it's really the strategic access point to how the whole spine is balanced and how it functions. To look into how that can affect our body, we first need to kind of look at the anatomy of these two and see what makes them unique, okay? Because we have 24 moving vertebrae in the spine. These two are quite special. C1 and C2 are the only ones that are built differently than the rest of the vertebrae. If we're looking at our spinal anatomy here, from the third cervical vertebrae all the way down the back to our L5 and sacrum here, all these vertebrae have a part in common, which are these bony locks that run up parallel here, and we call these facet joints. And the purpose of a facet joint is to lock these bones in place, provide a lot of stability, thereby limiting the capacity for injury. So because of that, the nature of how our body develops, we have the strongest muscles in our pelvis and low back here, support the rib cage and the internal organs through the thoracic spine. But really the C1 and C2 are the only vertebrae that are different, and that they don't have any facet joints. So they're freely moving and just held together by muscles and ligaments. And now the beauty of this is we get mobilization of the neck, right? We have nearly triple the range of motion in our neck than we do anywhere else in the spine because we're not restricted by those facet joints. However, the other side of the coin with that arrangement is that we do lack a little bit of stability in this area. So if we were to be subjected to what I would call a macro trauma, something like a whiplash injury, sports injury, a blow to the head, or repetitive micro traumas, so think abnormal postures, maybe you're crouched over a computer or a cell phone more than you should be, maybe you have abnormal sleeping patterns, and maybe for you it was a combination of the two. But somewhere along the line, we were subjected to this trauma. The C1, C2 are the most unstable vertebrae in the spinal column, and therefore they are leaving themselves vulnerable to misalignment. Now, if we were to have a misalignment in that upper cervical spine, it has a global effect on the body. So even though this may be the area that we're strategically focused on correcting, this injury can have an effect on a lot of different parts of your body. So let's take a look at that. So if we had a misalignment of the C1, C2, the first thing you notice is that it takes the head with it, right? Our head weighs about 15 pounds and it sits on top of our neck like the weight of a bowling ball, right? If that were to be misaligned, it would throw off the posture of our entire body. No one's gonna walk around with their head crooked, so we do have a compensation pattern we call the righting reflex, meaning our eyes always want to stay level with the horizon. So what that means is we start to compensate elsewhere in the spine to bring this back into balance. Typically, where we'll see physical symptoms show up first are generally where the spinal curves change. Oftentimes when we have an injury here, it doesn't always hurt right in that spot, but we feel maybe compensation symptoms such as muscle tightness, achiness, pain, pinched nerves, sometimes the base of the neck, mid-back, even in the low back. Everything is compensating for the alignment here. And so in terms of the correction process, it's all about finding out and correctly diagnosing exactly where the alignment is, very precisely putting the correction in to bring that back into balance, and then allowing the body to heal itself from the top down. If we're able to do that, it's going to be a much more long-term and permanent correction than if there were to be lots of very general mobilizations of the spine. So when we're looking at the anatomy of the spine, we just talked about the mechanical compensations that happen to your posture when that area gets misaligned. But there's also another very important aspect to this that we have to cover, and that is the neurological implications of the misalignment. The upper neck is the most dense neurological tissue of the entire spinal column. In addition to that, it does sit directly adjacent to the base of the brainstem, which is a very important part of our spinal cord neurological component. The brainstem controls all the autonomic nervous system function of the body. What that means is it controls all of the parts that are supposed to be regulating themselves. Think of things like your blood pressure, your breathing rate, maybe your circadian sleep cycles, our sense of equilibrium, all comes from this area. So if there was a significant misalignment in the C1, the body treats that like any injury, like if you were to sprain your ankle. It's an inflammatory response. So we get inflammation that can start to really irritate the nervous system tissue, irritate the brainstem, and then we can see a whole multitude of neurological symptoms come about unique to each person. And so one part to this misalignment is physical, the other is neurological, but regardless which camp you may fall in, they're all working together at the same time, and the correction is about removing the interference to that nervous system tissue and correcting the balance of the body.
So one thing that sets us apart is the quality of imaging that we have here in the office. It's 3D imaging, panoramic. It provides us with a level of precision that we really just haven't had before in the upper cervical world. Completely state-of-the-art. In a 30-second image, it gives us an opportunity to use the software to see exactly what we need to see. And the beauty of that is it provides us a level of precision that creates the best possible diagnosis and ultimately leads to the best possible results, which is really the most important thing. Another tool that we use in the office is the thermography scanner. This is something we'll utilize on every visit. It runs along the back of your neck, and it gives us a picture of how your nervous system is functioning. And so it's not directly measuring your spinal alignment. What it's doing is it's measuring the effect of your spinal alignment on the nervous system. So it's really a nervous system measurement. And it's something that tells us two important pieces of information. Number one, it tells us on any given visit whether you need to be adjusted or not. It also tells us after the adjustment we can redo the scan, and it gives us the information to tell us whether the adjustment worked. And so both of these pieces of information are important, and it's something we utilize on a visit-to-visit basis that helps guide our care. Another assessment that we utilize on a visit-to-visit basis is what's called the leg balance check. So what we do is we have you lay face up, and we're measuring your relative leg length. It's not because we think one leg is actually shorter than the other in most cases, but because of the compensation patterns in the spine due to the misalignment at the craniocervical junction, what we find is that it contracts one leg higher than the other when you're out of alignment. And so this is what we utilize as more of a postural check that helps us determine when and when not to adjust you, and then also helps us monitor your progress over time. Now I'd like to talk about the adjustment itself. It's extremely safe, precise, and gentle. Because of the diagnosis that we get from the 3D imaging, it allows us such a precision of diagnosis that we don't need to provide much force in order to get the correction that we want. It's unlike a traditional chiropractic adjustment in that your head is in a neutral position. There is no twisting, cracking, or popping. Another part of our office flow is the importance of resting after the adjustment. The correction is a lot of neurological input into the spine and nervous system, and so it's really critical to give you a chance to rest for about 15 minutes outside of gravity. So we put you in a zero gravity chair, and what that does is it provides your body a chance to integrate all the changes. And then after the rest, what we like to do is check you again and make sure that the adjustment worked.
So to maximize the benefit of your upper cervical care, it's really important that you stay in accordance with the treatment plan that the doctor has given you. Now, for anyone who starts care here, we always work in an initial time period of about 3 months, with the reason being, at a 3-month marker, we're going to have achieved a stability in the spine that's going to allow for some lasting changes that will stay with you and not just go back to the way that they were before. Now, the whole purpose of the treatment plan is to have you hold your correction for as long as possible. And so in the beginning of care, we may need to be checking you more frequently as you're prone to instability, right? But we are retraining your body how to hold the proper alignment. And that's really when we're going to achieve the most amount of change. So as you are moving through the treatment plan, we'll be expecting you that you're holding your alignment more frequently than you were in the beginning. And that's really the whole key, because as you hold, we're going to be retraining the new muscle memory, the new alignment, and the new posture that's going to help create stability in the spine. When we hit the end of that 3-month marker, we're going to do a full reevaluation. The reevaluation essentially is running through the same initial exam we did at the very beginning of care, where we can really see how much your body has changed and how it's functioning. And at that point, we'll know exactly what the next step is, and it's a good time to evaluate your whole health. The key part to understand of the treatment plan is that we only want to adjust you when absolutely necessary, which is why we say we have you come in to get checked for adjustment. So we're simply not going to adjust you because it's Tuesday at 3 o'clock and that's when your appointment is. If all of our measurements are indicating that you're in need of correction, we'll make the correction, and your follow-up visit, we're going to be seeing if that is holding or if it's back out of alignment. And that's going to really dictate when treatment is necessary. Now, it's really a less is more approach because we don't want to be adjusting you. When you're holding, that's really when the healing process is taking place. There's a little bit of a misconception that when we make the adjustment, that is what is helping your body heal. But it's really the matter of having the correct alignment in place over a period of time that allows your body to decompensate, stabilize, and retrain in the new muscle memory.
A few things to keep in mind when you're preparing for your office visits is that the scan that we take, the thermography scan, is temperature sensitive. So there's just a couple things that you need to keep in mind when you're coming into the office. We don't want to have wet hair or sweat or any type of lotions on the skin, especially the back of the neck. So just make sure your hair is dry, that you don't have any lotions on your neck, and then also scarves and high collars. If you have a scarf or a high collar, that's going to create too much heat on the skin. So it's fine if you come in with that. Just know, maybe come in a few minutes early and take off the scarf and high collar when you get in, just to give your neck a chance for the skin to just acclimate to the temperature for a few minutes. As a supportive part of the realignment process, what we do is provide you with at-home strategies that you can utilize, all with the purpose of helping to hold your adjustment and help support the work that we're doing. So two parts of this that are really critical are exercises and ergonomics. The exercises that we will give you really help to counteract what we call kind of the upper cross syndrome, or the sitting posture that's so prevalent in our society. And what that means is most of us have rounded shoulders and forward head postures from sitting. And so what we need to do is design exercises to help open up the chest and mobilize the shoulders and bring your head back to a more healthy position. And what this does is going to take stress off the spine and going to help you hold your correction for a longer period of time. Now, all these exercises are actually available in videos on our website. So instead of demonstrating them here, I encourage you to go to our website. It's on the Resources tab and Neck and Spine Exercises. And we'll introduce these visit to visit, just one at a time. But I encourage you to use the videos as a reference for the exercises that we'll go over on a visit-to-visit basis. The second aspect of the at-home strategies is ergonomics. So what we're going to do throughout the course of working together is try to troubleshoot kind of what positions your spine is in at work, at home, and during sleep. Because if we can keep your spine in the most natural, healthy position, of course that's just going to maximize our results and help you hold the alignment, which is what we both want. So some things to consider, and we're going to get into much more detail on a visit-to-visit basis, but something to consider when you're seated, whether it's at work or at home, is to have everything in front of you. You don't want to be turning your head for a prolonged period of time or at an awkward angle. You want to make sure that what you're looking at is in front of you, and then also level with your eyes, so you're not looking up or looking down. That's a really good starting point, and again, we're going to get into more specifics surrounding that. But if you can just start with that, I think that's a good starting point. In terms of sleeping, we've talked about this before, but you really want to avoid the stomach, and either sleeping on your side or your back or a combination of both is ideal. There are certain pillow strategies and positions that we're also going to talk about in detail in order to put your neck and your spine in the best possible position. But generally, side is okay. You want a pillow that's going to be a little moldable, and you want to fill the space between the shoulder and the neck so that it's not tilting one way or the other, but that your head remains neutral. When you're on your back, you also want that same moldable type of pillow, and you want to create a situation where the back of your head is able to come back a little bit and most of the support is in the middle of your neck. What you don't want to do is prop your head forward like this, where the support's too much in the back of your head. You really want the support more in the middle of the neck and allow the back of your head to come back a little bit.
Thank you everyone for watching. We look forward to seeing you in the office again real soon. And again, just as a reminder, if you know of anyone who you think could benefit from this kind of care the way that you're going to, we'd be happy to consult with them and see if we can be of help. We're always looking to help good people, and if they're coming from you, then we know that they're good people. And one challenge that we have in our healthcare system today is that there's a lot of people looking for the kind of service that we provide. They just don't know that we exist yet. So if you know of someone, please feel free to introduce us. We're happy to help. And again, thanks for watching, and we'll see you again real soon.